Hi, everyone. Thank you so much for joining our webinar, How Advocates Can Work Together. I'm Natasha Bonham, Director of Baby's First Test, and we're going to give it another minute or so as people log on, and then we will get started. Great. So we will get started. Thank you so much for joining us today. As I said, this is Natasha Bonham, Director of Baby's First, and we are really excited to be here and spending the next hour talking about how state and family advocates. Just to cover some of the webinar logistics, the webinar is being recorded, and a link will be available online on the Baby's First Test YouTube channel within 48 hours, so you'll be able to go back and listen. If you have any questions, please submit them using the chat box, and we will answer questions at the end of all the presentations so that we can have a little bit more of a dialogue. If you have any IT or need technical assistance, you can use the chat box to communicate, or you can email Jackie at babiesfirsttest.org. And with that, we'll jump into what our agenda is going to be today. So we'll do a very brief overview for Baby's First Test, since we know some people are just learning about it, and then we will jump into our presentation with Amy and Shanna, and then we'll have Q&A. So with that, so who are we? Baby's First Test is the newborn screening clearinghouse. The site, babiesfirsttest.org, launched about a little over 6 years ago, actually, in 2011. Really is meant to be a place to have that one-stop shop of newborn screening information, families and health professionals, and to really help guide people throughout that entire newborn screening experience. While most people are familiar with the website, babiesfirsttest.org, we also have a range of other programs, our consumer task force, and working with states and other partners in their education efforts, and really being a place where people can come and ask questions about education, how to get the word out about newborn screening. Here are just some quick stats that we have since 2011. I won't go into great depth, but this really shows kind of just the reach we're looking to have and why we think partnerships are so important. Because while we can do this through a site and some of our programs, we know that a lot of the real work happens on the ground with families, family advocacy organizations, and with the state newborn screening programs. And we really are always looking for ways that our efforts can help support those efforts that are on the ground. So, as many of you may know, we also have the Newborn Screening Public Square, which is on the site, and that's where we like to extend some of our conversations from our webinars and different conferences, that people who can't participate in real time when those events are happening have an opportunity to share their experiences and their perspectives. And we will also be doing a public square for this topic. As you can see here, how can newborn screening programs collaborate and partner with family advocates? So after this session, or if you keep thinking about it and tomorrow you get an idea in your head, oh, I wish I would have said that, no worries, you have a place where you can do that. And so we're excited to be able to have you join the conversation both today and in the upcoming weeks around this. So we are actually going to launch a poll, which you should see come up on your screen in the next minute or so. You can just go through and you can click on that in terms of why you're interested in newborn screening, and if you're interested as a parent, a health professional, state newborn screening employee, industry representative, advocate, or what have you. So you can click on that, and then we will then move forward and be able to jump into, oh, I didn't even realize you'd get instant responses. See, you learn something new every day. And as you can see, many people on this call are with state newborn screening programs, but we also have a good chunk of parents and advocates. So a really nice, who else is on the line with you? And with that, we are going to switch over to the main purpose of this meeting, and that is, and so we will be transferring over to them right now.
Are you guys able to see our screen?
Yes, we can see it.
Perfect. So I'll introduce myself quickly, and then I'll have Shanna introduce herself and start, and we're going to kind of go a little bit back and forth throughout our presentation, and very much looking forward to questions and dialogue at the end. So my name is Amy Gaviglio. I am a genetic counselor and short-term follow-up supervisor for the newborn screening program here in the state of Minnesota. And I'll pass it over to you.
Okay. Hi, I'm Shanna Quimby, and I'm a parent advocate for newborn screening. This is my son, Gavin, when he was about 3 years old. Gavin was diagnosed with metachromatic leukodystrophy when he was 3, December 20th, 2013, a day I'll never forget when he was diagnosed. We went through a lot of limbo with trying to figure out what was wrong with him. We had some MRI scans taken, and they were like, well, we feel like it might be MLD, but we're not really sure, so we're going to do a bunch of blood tests and send them out, and they all kind of came back inconclusive until we did the DNA test, and that came back that he definitely had MLD. So this took about 6 months, which, as a lot of diseases are, this is precious time where we could have been getting treatment for him, but MLD is not all that known. So we were, just trying to get through life, like, what's next? Is he gonna die? Is there any treatment for him? So we just kind of lived our life for the next 6 months, just doing the best we could. Like, we went to Disney World with the family, and he had trouble walking, so he was fitted with braces that had Superman on them because they were his favorite character. So we nicknamed him Super Gav. And the town of Winona, where we're from, was just amazing. They had a benefit for him, and July 19th was considered Super Gav Day, where he saved the city, where he got a key to the city and saved a burning building. It wasn't a real burning building, but there was firemen, and it was just amazing. Our town was so great to us in this time of need for us. And when he was officially diagnosed with MLD, the geneticist said we could go get a bone marrow transplant or a stem cell transplant at the U of M. So we went up there in August of 2014 and underwent chemotherapy for 7 days. And then he was given umbilical stem cells that matched him perfectly. So here's some pictures of him at the U of M. He's in his room. And then that's him with his little Superman braces on, playing the computer. He loved his little iPad with all of his games, and he stayed pretty happy the entire time. I don't know how he got through it, but he kept his father and I, Nick, happy. Just seeing him go through all that was really heartbreaking for us, but he did awesome. So we left the hospital about a month after he had received treatment, and we had to stay up in there because we had to be at least a couple minutes away from the hospital. So him and I stayed at the Ronald McDonald House for 3 months. And in that time, he got a viral disease in his respiratory system that we had to go back to the hospital for another month. And he somehow fought that off, even though he was immune compromised, and just got better. And we thought he would be okay. So we came home in November. Oh, these are more pictures of him, just us by the river. And as you can tell, he can still ride his bike and walk. MLD robs you of everything. You stop walking, you stop talking, eventually you can't swallow. And then these kids die. Sometimes it takes a couple years, and sometimes it takes just a few months. So we considered ourselves lucky that we had him, that he could still walk and do everything. So we came home in November and celebrated Thanksgiving, celebrated Christmas. Gavin has an older sister named Allie. She's 2 years older than he is, and they were the best of friends when they got along, and the worst of enemies when they didn't. Here's where they actually look like they loved each other. And when we were home, my friend Maria, who is the head of the Calliope Foundation for MLD Kids, called me and said, how would you feel about talking to your senator and seeing if you can add some newborn screening for Krabbe disease, which is another form of leukodystrophy? And we just happened to live in the same street as our senator. We were like, well, sure, we'll just email him and see what he says. So we emailed Senator Jeremy Miller and asked him if he would be interested in going forward with this. And he said, absolutely, he would be very much into that. So I talked to Hunter's Hope, the people at Hunter's Hope, who are also another leukodystrophy center, and the ball just started rolling without Nick and I even knowing what was going on. They were like, we'll take care of it. We'll just let you know when we need you to do presentation, and we were both more than happy to do that. So Gavin was still sick. He had a lot of respiratory problems, which we found out later was graft versus host disease in his lungs, which meant that all of the new cells were fighting his old cells, which meant that his lungs were slowly dying, and he was getting skinnier and skinnier because he just needed all of those calories to just live. So we would bring him up every week to the U of M, and they would tell us that his lungs were getting worse, but he was, still going to be okay. And so he came home every week hoping that we'd be able to keep him home. So this is February 22nd, his 5th birthday, and we celebrated together. And the way we knew he was really sick is he couldn't even blow out the candle on his own cake. And about 2 months later, we went back up to the hospital for another checkup, and they told us that he needed to be admitted because he had pneumonia. We ended up staying there for another 3 months, just him trying to get better. So he was on steroids and any other graft versus host disease treatment they could think of to get him better. And we finally came home in July of that year, just to hang out. But at that time, my husband and I were invited to come to the newborn screening presentation where I met Amy, and we did a presentation for why I felt like we needed to have the newborn screening for Krabbe disease. And MLD is not on the panel yet because they're still working on it, but Senator Miller had actually brought more diseases into the panel, is that what it's called, yeah, for us to maybe do. And now I'll give it to Amy because she knows more about that.
Perfect, thank you. So I'm going to kind of build on Shanna's story in terms of how we started to intersect with their goals and initiatives, and then I'll throw it back to Shanna to wrap up on the kind of the experience from an advocate and from a parent perspective on what went well, what would have been more helpful, and those types of things. So I'm going to start just kind of with a background on advocacy and newborn screening, because I think it's important to know that advocacy by both parents and scientists is definitely not a new concept to newborn screening. And if we even look at the first newborn screening disorder, so PKU, we can see that as far back as 1934, parents were serving as advocates for their children. So the PKU story kind of starts in 1934 in Norway with a mother who had 2 children, ultimately diagnosed with PKU, but really at that time that disorder wasn't known, and so she was really trying to have her physicians understand what was going on. And so that really led to the revelation of the increase of phenylpyruvic acid that can cause children to have mental disability. If we fast forward a couple of decades and move over to Britain, this is where we start to see, again, where a mother who had a child diagnosed with PKU wanted to know treatment, what can be done for her child. And so in really pushing with her clinicians, this led to an understanding of the importance of reducing the phenylalanine in formula, and so really a treatment for these children. And so if we go again a few years later to 1958, now equipped with a better understanding of the natural history of PKU as well as a treatment option for PKU, Dr. Robert Guthrie, who I think many of us all know, at least know of as the kind of father of newborn screening, worked towards an easy and inexpensive way to test for the disorder at birth. And then after having a personal experience, which I think is often how advocates kind of find their way into the newborn screening world, really began advocating for screening for PKU at the population level, because his niece was diagnosed with PKU, but not until later, because the hospital where she was born was choosing not to do PKU screening at the time. And so for him, it became important that it be offered to all children. And so I know this is kind of like a history lesson, but I wanted to provide the background because I think looking back at the role of advocacy in newborn screening can really help teach us about how it will continue, how we can continue to work with advocates, and how best to interact with them in the future. So for us in newborn screening, we tend to think of several types of advocates that we may work with, and it's really important for us to understand the similarities and differences amongst them. So at the top are medical organizations, and I think those are pretty self-explanatory. That's when we're thinking about the American Academy of Pediatrics, March of Dimes, et cetera. And these organizations can intersect with newborn screening programs on a variety of issues, whether it's improving education about newborn screening, thinking through clinical capacity to follow up on newborn screening conditions, program improvement, or funding. Certainly medical organizations can be seen as advocate groups. We also have federal partners who help make recommendations on what should be screened for, privacy organizations that look to how newborn screening intersects with genetic privacy laws, disease organizations, and Shanna mentioned one in Hunter's Hope. So those are certainly becoming more and more popular, I guess, in the newborn screening realm. So thinking through how you may interact with newborn screening programs, disease organizations, legislators, and individual parents. So for this particular story and experience, we kind of had the trifecta of disease organization, a legislator in Senator Miller, and of course the individual parents with Shannon, some of the other parents who came and met with us. So in addition to various types of advocates, of course, there are various goals that advocates may come to us with. Certainly right now, adding new conditions to screening panel is probably the most prevalent kind of interaction that we have, but you can see this list here indicates all areas where I think advocacy has driven or impacted newborn screening policy. In terms of what programs can do or how they feel about in interacting with advocates, we've been doing a survey to look at this to try to come up with some themes and some better guidance on how we can best interact with advocates. So right now what we're seeing is that state newborn screening programs have reported pretty variable ability to interact with legislators directly, ability and or experience interacting with different types of advocacy groups, as well as just general comfort with interacting with various advocates. So certainly a potential discussion point at the end of this would be for programs and advocates to help us think through what resources would be helpful to make this very important interaction as successful as possible. But with that, I will come back to the Minnesota example, and I added some pictures as well. So as Shanna mentioned, they worked with their Senator Miller, to introduce what was called the Super Gav Act, and you now know why it was called that. And that happened in 2015, which was an interesting time because it was also right kind of smack in the middle of when 3 new disorders, including 2 of the disorders that the Super Gav Act was seeking to add, were kind of going through the federal evidence review process and were being kind of slowly added to the uniform screening panel. And so I put this quote from one of the newspapers up there as well, and really wanted to focus on, kind of how we were able to kind of merge these 2 processes to come up with something that kind of worked for everything, or for everyone. So how this worked once we were notified of the presentation of the act, or the submission, I guess, of the bill, the Super Gav Act. Our division director and our legislative liaison met with Senator Miller and his staff to kind of discuss how we typically add disorders to newborn screening panels in Minnesota, which for us is typically done through the advisory committee. They are appointed by our commissioner and charged with making a recommendation to the commissioner to add a disorder. And this was also when both Senator Miller and his staff, as well as the Quimbys and other families, were invited to attend our advisory committee meeting. Kind of while that was happening, I reached out to Shanna and a few other families, and really just kind of said, let's get together and talk through this. So they came on site, and I remember it was shortly after Gavin passed, and so it was a tough time, I think, to get together. But at that point, it was very clear the resolve that you guys had.
We did.
And so I think we spent 2 to 3 hours. We did a quick lab tour just to kind of geek out, I guess, on seeing how we do our work. And then we just sat in a conference room and just basically talked about newborn screening in general, and what you guys were, the Quimbys and the other families, were really hoping to get out of this act. And we talked a little bit about why some of the conditions maybe weren't ready to be added, why some were, and really what maybe needed to happen for other conditions to get on the panel. Certainly MLD for you guys was kind of your, that's where your focus was, and we talked through what maybe needed to happen to get that more appropriate for population screening. And I will say that those are conversations that we continue to have on a regular basis. So what came of everything? Ultimately, we went through all of the disorders, including X-linked adrenoleukodystrophy, simply because that was being looked at federally at the time, and decided to add XALD, Pompe, and MPS1, and held out on Krabbe, Gaucher, Fabry, and Niemann-Pick. And you can see the justifications for why. Not surprisingly, many of it had to do with a lack of treatment or guidelines for medical follow-up for Fabry, Gaucher, Krabbe, and Niemann-Pick. So I know Shanna and the families were there at that meeting, and I think it was a good compromise outcome where certainly the Super Gav Act, helped us to look at some of the conditions and go through this important process. And I mentioned as well that we, our interactions and our collaboration and communication certainly haven't ended since then. We've maintained contact and kind of still talk about how things are going, both post-implementation. I let Shanna know how many, hey, we've got 7 diagnoses. Like, that's so exciting.
I cry every time when she tells me.
Not exciting for the families, but they're important pickups. So it's been, I think, a good way for kind of this ongoing relationship and thinking through newborn screening kind of at a population level, but also making sure that we're thinking it through what the advocate families are looking for. I did want to mention, and Shanna, I'm going to probably put you on the spot a little bit to talk about the Gavin Quimby Research Fund, because I think that was a really cool thing that came out of this and in understanding how important finding that treatment is for newborn screening.
Right. I agree. So we started this research fund through Boston Children's Hospital, and we are giving money to Dr. Biffy. She's from Italy, and she's been doing a gene therapy program for a few years now and has had a lot of success with children that have been diagnosed early with MLD. So a lot of the kids that are diagnosed, they've had an older sibling that was diagnosed and was being unable to be helped, but these kids don't have any, there's no signs of the MLD, which is why she's able to do this and basically turn their lives around so that they still have MLD, but the signs and symptoms don't show up until way later. And there's a child who's the same age as Gavin who got this done when he was 2, and he's still alive and running and biking, and he's a normal kid, where his sister died when she was 3 and he's almost 8 now. So a lot of the stuff that my husband and I felt when he was diagnosed was, anger, obviously, because you don't want your child to be sick, sadness. But mostly we were like, why doesn't anybody know about this disease? Why is this the first time I've ever heard about this? And why is there really successful treatment? And this gene therapy is successful, and we want it to come to the United States, and they're starting it. The University of Minnesota has been doing the gene therapy for the XALD, which is another form of leukodystrophy with very promising results with the kids. And I would eventually like it to come to the University of Minnesota, where Gavin was treated with the umbilical stem cell treatment. If Gavin had been diagnosed at birth and given this gene therapy, he would still be here with us today with probably 0 signs and symptoms of MLD. And that was another motivation for us to want to get this through, is just anger will do a lot of things for you. And we had a lot of that, like, why didn't somebody do this before? We can't be the first family that's ever had MLD. And we just wanted to make sure that other families had the chance for that to happen. And we feel like having adrenal leukodystrophy started is a good start for us. So that's where we're at right now.
Okay. Yeah, I think when I'm thinking back to when we first met and had that conversation and, thinking through, okay, if newborn screening isn't the answer now, what are some other things we can do? And we talked a lot through increased education, of, making sure that individuals knew that this disease existed, and, if looking at family history and those types of things, but also, how important it is for a good treatment for us to start thinking about newborn screening. But I also agree that it was nice that XALD kind of felt like a victory for the leukodystrophy community.
Absolutely.
So I'm just going to end. This is my last slide, in just kind of indicating how important it is for, I guess, I'm just realizing it's the 3 Ps, people, policy, and program, to really work together and figure out, a way where we can all kind of intersect and be on the same page. So with that, I'm going to swing it back to Shanna, even though we've been doing that a little bit back and forth, to wrap up with kind of the outcome from their perspective of what's been done in Minnesota in terms of addition to the screening panel.
Okay, so this is my husband, Nick, and me and our daughter, Allie, with Senator Jeremy Miller in Winona. That's where I'm from, at Winona Health, and this was the day that the Minnesota Department of Health came down and told us that they were adding the 3 diseases to the newborn screening panel. So it was a successful day for us. We felt like what we had wanted done was happening, and it was kind of surreal. So coming to that with, Amy wants me to say what I felt like could have went better. I guess I didn't know what to think. I didn't know like where to start. I didn't know who to talk to. I felt like Senator Miller did a really good job with getting a hold of the people that he needed to talk to, like Hunter's Hope, Amy, newborn screening panel, and Nick and I were just willing to do anything that they needed us to do. So I was surprised at how long it took to do it. I was kind of like, why don't you just do it right now? Just put it on here. You're saving kids. But I guess it's a process. So I didn't understand that. Also, I learned when we were giving our presentation that money is a huge issue, which I didn't even think of, that you need to obviously pay for all these tests to be done, and not everybody has $250 to spend on a test. And so that was interesting to me too. And then I didn't understand the reasons of why they would choose a certain disease until I went to these committee meetings, and they said, you have to have a treatment for it. And not all parents want to know that their child is sick. A lot of parents just kind of want to have a baby, bring it home, and just be happy with it. And there was a day I probably would have felt the same way until it's your child. And then you want to know everything, that especially if there's a treatment for it before it's too late, because a lot of these diseases, as soon as you find out that you have it, there's no treatment and there's really no way to save them. So yeah, I can't think of really anything bad. It was mostly a really good experience for us. And yeah, I have nothing good to say. I have everything good to say about how it went through the state of Minnesota.
Perfect. So that, Natasha, that's kind of what we put together, and I think we're very willing to answer questions or open things up for discussion.
Great, thank you so much. That was a great presentation, and I love how you guys went back and forth. I think you covered a lot of ground on this. One thing I wanted to delve into just a little bit is kind of on your last comments, talking about that while you think everything went well, you just didn't know where to go. And could you talk a little bit about like where you first started? And I'm asking that question trying to think of if there's certain types of information or how we could shrink that amount of time from you being motivated and trying to figure out what to do next for Gavin and for all the babies, and getting to kind of the right people and the right places.
Yeah, so it was actually my friend Maria, who was very into like the rare disease community, and she knew people at Hunter's Hope that had already got ALD added onto their list in New York, and she was like, would you be willing to do this? All you have to do is just get a hold of a senator, like anybody. And I was thinking it was going to take a long time for this to happen, and being that we knew Senator Miller personally, and he was from our hometown and knew Gavin's story, it was relatively easy. And he, like I said, he just kind of took the reins and, got a hold of all the people that needed to be communicated to. But I've heard of other people where they've had to call dozens of representatives for their state and, jump through hoops. And yeah, the only thing I can think of is you almost have to find the right person. And, you don't know who to look for if you don't know anything about this. Maybe the hospitals, if have more education on something like that.
Yeah, and I think that's a really good point, that it's not necessarily so much, finding the right person with the right title. It's really finding the right person who maybe already sees themselves as a champion or can be a champion. And that can be either from the legislative side or the public health side or the medical side, that it's kind of finding the right person, not necessarily the right role.
Right. Yep.
Yeah, Natasha, I think it's interesting too. I mean, I wonder if there's a way, and because I don't know, Shanna, if like the idea of contacting the health department ever came up or came into your head, and I wonder, I mean, that would be a good, especially if it's going to be something talking about newborn screening. Certainly, we would want to be involved earlier than later. So maybe how we can better bring ourselves up to the top of the list of people to contact.
Yeah. Yep.
Yeah, I think that's kind of part of the sharing with more people kind of the role of public health and the public health department, that it's not kind of this black box, but that there are actually people there who are doing all this really great work and want to engage. I guess one thing, Amy, if you could touch on a little bit kind of what you through Minnesota are able to do with advocates to partner, how you're able to partner with advocates. I know that changes depending on which state you're in, but maybe giving a little bit of that framework, like the framework that you're working in.
Sure, yeah. So I think that this example is a pretty good, I guess, indicator of how it typically works here. Though this was certainly kind of the first time we took this type of approach, and I've been really happy with the way that it's gone. But typically speaking, from the legislative side, if there's something, a bill or something that may affect newborn screening or may impact newborn screening, typically those conversations tend to happen with our legislative liaison or a division director, who will actually be kind of the mouthpiece for the program. Certainly before they go and meet, and this was definitely the case with Senator Miller, we work with them and just kind of prep with any potential questions and answers and those types of things. Of course, just like I think any other newborn screening program, we cannot advocate or lobby ourselves. So what we're really doing is providing, I guess, quote unquote, technical assistance or information. So for this particular situation, we certainly did kind of the typical thing that we would normally do with any bill, and trying to talk with the senator and or staff. But I think for some reason for me with this, it was really important to talk with the families too, which is something we hadn't really done before. And so I kind of just proposed it to our, my management and division director, and, just said, I think this is a potentially good opportunity to provide some education, of what are the things that we think about when we go think about adding a disorder, because I think, like Shanna said, I think most people don't think about that.
No.
I mean, it's especially when you're in the moment of having a crisis and a child with a rare disease. So they were pretty supportive of it, and so we scheduled it. And I think just now that we've done it once or twice, I think we're certainly able to interact with advocates, and we're encouraged to have conversations, and it's just trying to make sure that we respect the balance of we ourselves cannot be advocates, but we can certainly provide information and to some extent some guidance in what needs to happen for newborn screening to be successful. So I think we are fairly lucky in that we do have a decent infrastructure to engage on multiple different levels.
Great, that's really helpful. Amy, just make sure that you're on mute. I think they're on mute now. Like I was saying, that's very helpful to kind of give a sense of the framework that you were working in that allowed for that relationship to build, and also that sometimes you have to ask. There's a first time for everything, and so being able to go and ask and see if you can speak with the families that led to this really great partnership and relationship. I wanted to let you guys know that we've gotten a couple comments about just how great this presentation has been, and thank you so much for sharing your story, and to see kind of the positive things that came out of a really, really hard situation. And one thing that we wanted to let people know is that the webinar will be on our YouTube page, but also in our resource center. And so you can look for it there in the next couple of days, and feel free to share that and to use that in whether it's in classes or with others around education, so that you can do that. So this is a question kind of back to our presenters, but what type of resources are out there for people interested in getting into advocacy? And I'll let you guys kind of start that off and add in anything from the Baby's First Test perspective if it comes up.
Okay, I'll try to take a stab at it and let Shanna think a little bit. I think certainly there are foundations out there, and it sounds like that's kind of how you guys got hooked in. But I think NORD, so that's the like a rare disease organization. They tend to have Minnesota chapters or state-specific chapters. So I think that there certainly are resources out there. It's a matter of finding them, I think. But I think that's a good first step, is just to look at kind of the rare disease community. And I actually think there was just a rare disease advocacy. Shanna's like giving me notes. Rare Action Network of Minnesota. So there's probably rare action networks in other states as well. I don't know what else you found helpful as you were kind of entering this journey.
I feel like everybody just did everything for us. Like I would get emails from you, and I'm like, oh, we're working with her now. And then I would get emails from Senator Miller, and then later on I met Erica Barnes. She's also she's a NORD person and she has meetings like once a month for parents in the area to come and talk about, like rare diseases and where they can get help and things like that. I think if you were just to Google newborn screening, there's a lot of things that pop up. I know that we looked up things too online. So the internet's very awesome for things like that too. And it will direct you to who the proper channels are for that.
I would say from a program perspective, one thing that I've found helpful as well is that a lot of times these organizations, especially NORD, will have a rare disease day at the Capitol. And so having a newborn screening program person attend that, I know I've gone the past couple of years, and it's been very, very important, I think, just so that that community sees the face of someone in newborn screening, and you can kind of hear where things are being talked about in terms of newborn screening, or maybe not, maybe things like insurance coverage. But I would say from a program perspective, in terms of kind of keeping your finger on the pulse, things like that can be really, really helpful.
Agreed.
Great. I agree. I think that combination of looking at the national organizations such as NORD, which is the National Organization of Rare Disorders, as well as the local affiliates, is a really good kind of 1-2 approach to be able to connect to some of the broader issues that are happening, but then also seeing how you can relate that to what's going on at the state level. On Baby's First Test, on each of the condition pages at the bottom, there's a list of advocacy organizations. Some of them are more on the support side, some of them are more on the research side, others are more policy, but that can also be a good kind of first step if you're looking for condition-specific advocacy approaches. Great. Well, with that, we don't have any other questions coming in, so I will leave kind of see if you guys have any other kind of last words, parting words, or last things that you'd like to say for this session.
Oh, this was great. Thank you for inviting me. I liked this a lot.
Yeah, I would just echo that too. Thank you for letting us kind of share our experience, and you know, I hope that others can take some things away. And but yeah, thank you for letting us have this discussion today, Natasha.
Absolutely, and the discussion doesn't end here. We invite everyone to come back and join us on the public square and leave comments, questions there. I'm moderating that, but I know Amy's often on there and can provide additional answers or engage in different topics. Everyone is able to log in and to comment on the public square, so we look forward to seeing you there. But thank you so much to our presenters. This was a great session, and I think, again, it really highlights the importance of, you know, no matter where you are in the newborn screening system, we all have things that we can learn from each other, and the way that we do that is through partnership and that open communication. So thank you so much for sharing your stories and your perspective on that. And we hope everyone has a great afternoon. Thanks.
You too. Thank you.